Module 11, Special Populations. We will be exploring homelessness within the United States and its impact on health, vulnerability, and legislation. Presented by Bryce Cattarelli. As highlighted by Gabriel Raylich in his popular video, if the world were divided into just 100 people, 23 individuals would not have shelter. Homelessness is a situation that impacts more than 3.5 million individuals within a given year within the United States. When evaluating this population through the lens of social and health determinants, they experience significant impacts in all four realms, including inadequate and potentially unsanitary environments, increased behavioral risk factors such as poor nutrition, potential predisposition to hereditary mental health disorders, and limited access to appropriate medical care. It creates a unique vulnerability that greatly impacts quality of life and overall health status for all those impacted. In fact, homeless persons experience a life expectancy of just 41 to 47 years compared to the national average of 78. Vulnerability refers to the likelihood of experiencing poor health or illness. Poor health can take many forms, including psychological, physical, or social. It is influenced by predisposing, enabling, and need characteristics as outlined by the vulnerability framework. These three characteristics influence health for vulnerable populations, including likelihood to get sick or recovering from illness, and determining access to health care. The more risks, the more likely for the individual to have a poor health overall. Predisposing factors for homelessness include racial ethnic characteristics, gender and age, and geographic location. All statistics are provided by the 2015 Annual Homeless Assessment Report produced by the U.S. Department of Housing and Urban Development. Roughly 60% of all homeless people are male, while 39.7% are female and 0.2% transgender. Hispanic individuals comprise 20% of the homeless population, though most were either white at 49% or African American at 40%. Over 22% of all homeless people were under the age of 18, and on a given night, almost 50,000 veterans were homeless. Interestingly enough, more than half of the overall homeless population within the United States live in just 5 states: California, New York, Florida, Texas, and Massachusetts. Enabling characteristics according to the framework include insured status and homelessness. In this case, the vast majority of homeless individuals are uninsured, though the proportion of the veteran population can receive care at the local VA hospital or clinic if one is available. Homeless shelters are inadequate to service every homeless individual, with an estimated 38% of the homeless population unsheltered. Often the homeless band together in small communities positioned in rural or undeveloped areas. For example, Gainesville was home to Tent City for many years, housing hundreds of individuals in temporary tents. These individuals range from those considered chronically homeless, accounting for just 15% of the average daily homeless population, to those who were temporarily out of work or recently evicted. The Ocala National Forest is home to hundreds of homeless individuals as well, including many veterans who stay for local VA healthcare networks. These small communities can be found across the nation, though they are inadequate for serving the needs of this population. Need characteristics in this population include a large proportion of mental health conditions, chronic illness or disability, and infectious disease. It is difficult to say whether mental health conditions are more likely to predispose one to homelessness, or if simply being homeless makes an individual more likely to suffer from depression, substance abuse, or other mental illness. Many women living in these circumstances do so as a direct result of domestic violence as well. Living outdoors in unsafe conditions, from crime, weather, or other, can also predispose one to an increase in disability or poor nutrition. According to our text, homeless adults average 8 to 9 chronic illnesses, while children who are unsheltered are twice as likely to die than those who live under a roof. There are many barriers to health care for this population. They range from cost to fear of institutionalization to lack of transportation to poor organizational skills at managing appointments or medications. 2 stand out when reviewing the literature. One aspect is lack of transportation to clinics or doctor's appointments. As a result, an expensive ambulance ride may be the only means of getting to the emergency department for either routine or emergency healthcare services. The cost of healthcare services is often substantial for this population, as many are uninsured, and the cost of healthcare competes with basic living costs when balancing priorities. Many do not have access to primary care services or medical homes that allow for primary and secondary prevention for common health ailments and therapies. This is due to lack of health insurance and often unemployment status. Within the VA health system, homelessness is proven to add substantially to costs of health care services for those with mental illness. In fact, it increased the cost of care by over 13%. With the potential of declining public funding for health and social welfare programs, and an anticipated increase in the number of homeless, mentally ill individuals, organizations and communities may have a difficult time meeting this population's diverse needs for health care at affordable costs. Due to poor access to health care, homeless individuals suffer from many poorly controlled chronic illnesses and disabilities. It is well documented that this population suffers from increased rates of infectious diseases as well, such as pneumonia, tuberculosis, and HIV. Studies show that homelessness is a significant risk factor for uncontrolled diabetes with comorbid conditions such as substance abuse, liver disease, and fluid electrolyte disorders among the veteran population. Nutritional status is very poor, with diets that often feature high saturated fat contents and deficiencies in fiber and important micronutrients. This predisposes the population to poor health, adding in highly unsanitary living conditions and inability to store medications appropriately. Poor health extends beyond the adult population and impacts children as well. Children who experience homelessness are more likely to develop high levels of stress, health problems, and the need for more frequent health care, leading to higher rates of hospitalization. The homeless population would directly benefit from the concept of social justice in the approach to providing health care. It views health care as a social resource and does not base health care provision on the ability to pay for services. In this sense, equal access to health care is determined to be a basic right. It can be considered a public solution to social problems, where the community well-being is more important than a single individual. The Affordable Care Act is an attempt to provide health care under the idea of social justice by expanding federally funded health insurance through exchanges and expansion of Medicaid services in each state. It makes health insurance much more affordable and decreases financial vulnerability that may contribute to homelessness. It ensures coverage of important health services for this population, including behavioral health and rehabilitative services, while shifting the focus of healthcare to the health of a whole individual and encourages partnerships between healthcare and social services. One study found that homeless persons may not know about these expanded benefits under the Affordable Care Act and have poor access to the internet or phone to sign up for these services. As many homeless people receive their medical care in ERs, an emergency-based outreach to inform this population on the Affordable Care Act and its criteria is a serious solution offered by the authors. Expanding available homeless shelter systems can significantly improve health status and access to care for newly homeless individuals struggling with physical disease and mental illness. One means of combating this issue may be expanding funding for and increasing access to homeless shelters in high-risk communities. Utilizing well-established and respected organizations such as the Salvation Army may be an excellent means to start. These communities should be targeted by public health departments following a community health assessment. Free healthcare clinics are appearing in high-risk areas as well, including the volunteer-based free clinic in Gainesville, Florida, that services hundreds of homeless and uninsured individuals one night a week. From a federal perspective, clinics such as these can be initiated under the Health Care for the Homeless, or HCH, program to provide free medical and laboratory services. Public health clinics also can provide free immunizations to children within the state of Florida under the Vaccines of Children program. This is an easy, relatively inexpensive means of protecting those most vulnerable in this population. Question number 1. What are several services available in your area to serve the homeless population, and do you think they are making a measurable impact on meeting the physical and mental health needs of this population? Question 2. Do you believe the Affordable Care Act will be successful in reducing rates of homelessness across the states and improve health care for this population? Why or why not? Question 3. Which health determinant, as outlined in Blum's model of health determinants, is most impactful on this population and their overall health status? Thank you very much.